Nigeria, the most populous black race in the world and the giant of Africa, has been burdened with increased cases of sexual and gender-based violence, child marriage, obstetrics fistula, and female genital mutilation. Its very existence have a very devastating effect on its survivors and denied them their very human rights.
Ya tura min ragga cikin bakina, ya taushe ni, sannan ya gama abin da yake sai gaje ni malalala.
Addressing these social norms of SGBV and harmful practices in Nigeria, UNFPA, in partnership with Global Affairs Canada, began its intervention in 3 key states, Sokoto, Bauchi, and Oyo states. At the core of their intervention is the reduction in the prevalence of SGBV and its subforms by providing an enabling environment, treatment, and care for affected women and girls and prevention of future occurrences.
We started with by engaging our community people.
We're able to carry out multi-level community sensitizations, community town hall, traditional rulers training, and the issue of printing messages that we deliver to liberal religious congregations.
And then we have had so many sensitization programs on the verb law, engaging women groups, youth groups, to sensitize the community.
And aside from that, we're able to build the capacity of judges, of magistrates.
Training also with law enforcement agents, community-based organization, and civil organization.
At the community level, UNFPA inaugurated or introduced this community GVV response and referral network.
This UNFPA provides a set for us and a toll-free line, which enables the other people to be calling free of charge without putting money in their line.
Another major worry is the concern for the girl-child early marriage. Its fallback effect is the increasing number in child marriage. 43% of women aged 20 to 24 were married before or by 18 years, resulting to an estimated 22 million child bride, which represents 40% of all child brides in Africa.
During this our intervention, we have a group that we call husband schools.
Nobody would think that you can gather a lot of husbands in one room and then discuss issues that concerns women with them. But it worked.
These role models, they also go into house to house to see where, if our girls has problem, and even intervening.
We have also had safe spaces in schools where we catch the young girls early.
What the children learn, as I told you, has been put into practice, because you can see the changes even among the girls, how they interact with people, and also what they learn based on personal hygiene, based on the health reproductive system, and they are even contributing within the school and even within the community.
As far as I am educated, now I'm in SS1, and others that don't have the opportunity to come to school, I will also advise them. As far as I don't have anything to help them, I will advise them, only my advice maybe to help them to pick up. And that is why I want to talk about safe space. Even though I grew up, I will be whatever I want to be, but I'll still be talking about safe space because it has helped me throughout my life.
The risk of female genital mutilation is estimated at 14.8 million come 2030. This is following the prevalence rate of 19.6% amongst women and girls aged 15 to 49, whom have been mutilated. Oyo State is known for its unabated practice of female genital mutilation. Under this intervention, UNFPA, in partnership with Global Affairs Canada, engage in high-level sensitization in different local government areas of the state.
We started by having core trainers, that is, trainer of trainees, which were drawn from these 5 local government areas. After which, we were able to give comprehensive training to our health workers.
So we had done a lot of radio programs in Yoruba. We had gone to communities to sensitize.
We identified the in-school children, and that we want to really take them, catch them young, and instill them with that good moral practice and dietitian harmful traditional practices.
And to date, 10 communities have declared abandonment in Oyo State.
So we have community champions who are still working. We still facilitate them to work. They still go about in different groups to talk about FGM as a sort of reminder even for the communities. So that's an issue of sustainability.
Approximately 150,000 women and girls awaiting treatment, representing 7.5% of global burden and 13,000 new cases annually. Still, fistula is almost entirely preventable. UNFPA, in partnership with Global Affairs Canada, also focus on caregiving, treatment, as well as sensitization on the effects and causes of fistula in a bid to curb further occurrences.
UNFPA, when they came, I remember in 2019, they trained, we had basic level fistula training. So I can vividly tell you, confidently, I have no fear examining or repairing any type of fistula.
They have supplied us with consumable for pool effort and also for routine repair.
Then we also organize fistula repair campaigns. In this process, we do a lot of jingles, community mobilization, including training of fistula survivors as advocates.
UNFPA also made it possible to establish a center that is near or as close to these people that are suffering from these diseases. I can tell you one of these centers is the one in Gamawa. It improved our number of repairs significantly to about more than 20%.
Excellent among the impact is the new center at the Goronyo Hospital, General Hospital Goronyo and Goronyo local governments. It has added, it has reduced travel time, it has reduced suffering for people, and also brought BBS service nearer to the people.
A yanzu da ina kuka da idanuna gashi yanzu ya zamo tarihi na dawo ambassador.
It is clear enough that the UNFPA, in partnership with Global Affairs Canada intervention, has indeed made an impact in these 3 states.
This is something in my whole career that I think has had one of the greatest positive results from all angles.
And I think particularly so because of all the challenges related to the COVID-19 pandemic, all the disruptions that caused, some of the delays, but also some of the rising insecurity in certain project locations. So I think UNFPA has to be, really commended for their determination, their grit, their ability to deliver real results throughout the project.
So in all the 3 states where we are with the Canadian government now, that is Sokoto, Oyo and Bauchi, there we are already now discussing with the government how do we continue so we can really harvest all the gains from these projects. So it's a more holistic approach that leads to more equality, leads to better health for women and girls, and of course leads to rights and choices for women and girls in the states, which eventually will lead to a world that UNFPA is really championing, which is a world where every pregnancy is wanted, where every childbirth is safe, and every young person's potential is fulfilled.
Gaskiya ina godiya kwarai ga wagga kungiya ta taimakon mata saboda ta ceto mu daga cikin abin da muke ciki da muna ganin bamu da yanci amma yanzu mun shigo cikin mutane.